Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. In this video, time for the weekly update. And heading into more holidays, starting at nearly the highest active cases of the pandemic. But there may be a glimmer of hope, and not just that vaccines are now here. So please share this with someone you care about. As you can see here, 47 of the 50 states now in the red, and only one of the three just barely. For our neighboring states, all worse off, including Tennessee, today with the highest rate of new cases in the entire country. In North Carolina, 95 out of 100 counties are in the red, and there is a continuing upward trend in new cases compared with 2 weeks ago. And the 7-day rolling average of new cases per 100,000 population, and in parentheses the actual number of those new cases. In Western North Carolina, you can see that all the Western North Carolina counties are now in red, except for Clay. And the increases are all very significant compared to 2 weeks ago. Remember, the goal is to be below 10 per 100,000 population, and no one is even close to that. Also, test positivity rate for North Carolina now 10.6%. Haywood County is at 9.1%. Jackson County at 17%, and Macon at 9.8%. And remember, below 5% is the goal. No one is even close to that. We know that an increase in cases precedes an increase in hospitalizations, and that precedes an increase in deaths. And these trends all continue upward across North Carolina. Mission and Haywood Regional have roughly doubled their COVID-related admissions, but are still in okay shape for now. In Haywood County, 66 people have died now related to COVID throughout the pandemic, 15 of those in just the first half of December alone. For Haywood County, cases for the entire pandemic are now at 1,765 as of yesterday. And as you can see, new cases continue to follow the exponential curve. In the past month, interestingly, only 17% of those cases are related to a long-term care facility, and half of those are amongst the staff. In the most recent 200 cases, only 8% are long-term care facility related. Due to the sheer volume of work in the current surge, the health department has suspended monitoring those in quarantine, so there's no update to the COVID working number. But here you can see in blue the curve of those who are positive and in isolation. In red, the change week over week in this number, so measured Monday to Monday, Tuesday to Tuesday, etc. And the two have tracked together during this surge, but note that now they are diverging some. The number in isolation continues up, but week over week is now dropping. And the last time these diverged was coming off the surge in the summer. And there might be some more positive indicators for Haywood County. On December the 10th, we were at 53 per 100,000 rolling average of new cases. And after the Thanksgiving bump, we wondered where we would be headed. Well, today, we're at 42. And for comparison, look again at North Dakota. It peaked at 216 on November the 8th. Now, it's all the way down to 44, less now than North Carolina. 2 weeks ago, Haywood County had the highest rate in Western North Carolina. And although still very high, Haywood County has remained stable, and others have vaulted past. So we now have a window of opportunity. We won't likely see a bump, if any, from Christmas until after New Year's, at 7 to 10 days later. So our focus now is today until New Year's. If we can drive down the rate of new cases even further, then whatever surge we see will not peak so high, meaning lower hospitalizations, lower deaths, faster recovery. The arrival of vaccines is great news, but honestly it will be months before enough people are vaccinated and for the impact to be felt. So now is the time. Act to protect those around you. Act to protect yourself. We all want to be able to safely gather again, and our next step in that direction starts today. So be well and be careful, especially right now.